Representative Kutz.
Afternoon. Thank you for being here. Cumberland County, the 87th district, is one of the places home to more nursing homes than most places in our Commonwealth. So I have a question relating to some of the nursing homes in the district I represent. As you know, in 2022, November, updates to nursing home regulations that were finalized included within those updates were increases in minimum staffing requirements for nursing homes. The first phase of these new staffing requirements took place last summer, July 1, 2023, and almost immediately I heard from several nursing homes in my district about enforcement of these staffing requirements that seemed sort of inconsistent with the regulatory intent. But I was pleased to learn the department, at the urging of nursing home advocacy organizations, amended the initial interpretation and the manner in which the regulations were applied during inspections. So my question, as nursing home operators prepare for the second phase of these staffing regulations to take effect as of July 21, 2024, how is the department handling good faith efforts made by nursing homes to meet these required staffing ratios?
Thank you. Long-term care really, they take care of our most vulnerable community members, and so it's really important that we all work on this together. I'm happy that we sort of have two separate arms of our long-term care work in the Department of Health. One is the regulatory arm that you're referring to, which is our quality assurance arm, and we are trying to be, as you pointed out, reasonable regulators, really balancing the needs of the regulated community and ensuring the safety and well-being of those that they take care of. And we're continuing to work with all of the community members and stakeholders around these issues and making sure we're responsive and listening to what they have to say and being as flexible as we can, but again, ensuring safety in those areas. We have, over the last couple of years, been working on a program that's now called the Long-Term Care Transformation Office. That is separate from our quality assurance arm. And that office is specifically to help build resiliency and to help long-term care facilities be able to move into the next phases and really be prepared for emergencies, and to have the workforce that they need. So we are working basically both in a regulatory arm and in this long-term care transformation office to really help long-term care facilities be prepared for the future.
As a follow-up, if I can ask, these staffing ratios are well intended, but not always black and white. I'm curious, obviously facilities that continually and repeatedly miss these ratios should face enforcement actions, but how are you dealing with, are you looking at the circumstances around each of these actions before tagging the nursing home with a deficiency, if there's extending circumstances or anything that makes them kind of have a one-off miss on their requirement?
Sure. Thank you, Representative, for the question. So anytime we approach our facilities, our goal is to get them into compliance. So any situation with a nursing home where they're not meeting the ratio, our goal would be to get them into compliance with that ratio. I will say, as you mentioned, we did have an interpretation change of how we're calculating the ratio, and that was directly in response to the facility's concerns around meeting ratios, specifically around when people call off or they have to leave early to pick up their kids from school, right? So we did actually change that to meet facilities where they are, and we would do the same in this case. And for those facilities that are struggling meeting the ratios, we would connect them, as Dr. Bogan mentioned, with our long-term care transformation office for that technical assistance in support around workforce and trying to get folks into the facilities to make sure they're able to meet those ratios.
Excellent. I certainly appreciate those efforts to work with our facilities to do that. I know folks in the 87th district will be happy to hear that as well. Thank you for that, and thank you, Chairman.
Representative Schmitt.
Thank you, Mr. Chairman. I would love to talk about medical debt, but I don't think I could improve on the gentleman's questioning. I want to ask you a little bit, Madam Secretary, about long-term care nursing facilities, and more particularly the regulations that were promulgated by your department that went into effect in July of 2023, with additional changes becoming effective in July of this year. I mean, we can pass all the regulations we want and all the statutes that we want and all the laws that we want, but I think what we're facing here is a real issue of demographics. I don't know what the replacement birth rate is in Pennsylvania, but I know we haven't hit that replacement rate in probably a half century or more. And so we're in a situation now where it's not where we're running out of babies. We ran out of babies decades ago. We're running out of working age people now. At the same time that we're running out of working age people, the baby boomers are leaving the workforce by the millions. And some of those employees, those baby boomers, are some of the most dedicated, experienced, highly trained, hardworking employees that are out there. So last summer, when these regulations went into effect, some of the administrators of some of the nursing homes in my district and my county, we got together, and they're really, really concerned. I mean, they're concerned about the ongoing viability of their facilities. Now, I know that the legislature appropriated $294 million for long-term care providers in fiscal year 22-23 and $31.6 million in 23-24. We certainly recognize the importance of patient safety. But I'm concerned about these regulations, the unsustainable manner in which these regulations tend to be in that industry. I'm concerned about the loss of capacity, which trickles down to other areas of our healthcare continuum, such as hospitals. And by the way, because of staffing shortages, UPMC Altoona in my district has closed 100 beds. So we're in a situation where they can't handle these cases that come from skilled care facilities. And they're becoming overwhelmed as well. Does the department have an exception or a waiver process or an exemption process in place for facilities that are able to demonstrate quality patient care with a staffing structure that doesn't align exactly with the ratios?
So first of all, thank you for that question. You know, long-term care, like all of our healthcare facilities, are struggling with workforce shortages, and we all need to work on that together, on how do we address workforce shortages and to build that resilience. I did talk briefly about our long-term care transformation office and the work that they're doing. And again, I always put my prevention hat on first. So again, regarding the aging population, we need to work together to make sure our aging population can age at home and age well for exact reasons that you said. And I'm going to let our EDS answer your specific question about our regulations.
Sure. Thank you, Secretary, and thank you, Representative, for the question. So we do have a process for waivers and exceptions. So we review those all on an individual basis, and facilities could, submit one that we would review. I will say, in terms of the ratios, we did a lot of stakeholder engagement through that regulatory process to really balance the needs of the workforce while also making sure that residents are safe. And so what we came up with was a reasonable compromise between stakeholders, facilities, and the department to really reach something that was reasonable. And as the Secretary mentioned, we do have the Long-Term Care Transformation Office in place to support facilities. That's really a technical assistance and resource support for facilities. So we have a lot of workforce initiatives within that program that can really support facilities to keep, and keep residents, to your point, out of the emergency department, keep them in the facility so we're not overloading our hospitals.
Is there a way
Can I just add one more thing? I also want to say we have been looking at whether, when we go for our visits, whether the homes have been able to meet the requirements, and most of them have been able to meet the current requirements.
Thank you very much. That's all I have. Thank you, Mr. Chairman.
Representative Eric Nelson.
Thank you, Mr. Chair. Lots of love in the room today, right? A lot of positives across the board. And I do want to just very briefly start with recognizing, some good work that DDEP has been doing, Westmoreland, Allegheny counties, particularly in the area aftercare. Our overdose fatalities are declining. Hopefully those programs will be able to continue. But my questions are with the other testifiers, because it seems like those programs are going in the opposite direction. In particular, I wanted to pick up on our long-term skilled care facility. One of the last things that, Madam Secretary, you mentioned was that most facilities have been able to meet those guidelines, but the full truth is because they've had to take beds offline. I think the survey just this year, 48% declined hospital admissions within the last 2 to 3 months because they had beds, but they weren't allowed to use them. Almost 15, right? If I'm right in my facts, 4 out of 10 facilities have certified beds of 15 or more that are offline. And so when we can't treat our seniors, those facilities aren't allowed to bill, and that forces them to close. So similar to the hospitals, 25 long-term care facility closures in the last 4 years, 7 closed just last year. But, you know, we have more seniors, we have less facilities, and Governor Shapiro has flatlined long-term care in his budget. Why?
Thank you. Again, I'm not sure I have anything different to say on this one that I said last time, but again, this is really an issue of workforce development and making sure we have a pipeline of people to work. Nurses, there's a nursing shortage in every part of healthcare.
And I agree, but I mean, to run parallel, if we provided funding for our long-term facilities, long-term care, wouldn't that help to be able to keep those facilities open so our seniors have a place to go?
Well, again, happy to work with you on that as part of this process. We look forward to working with the legislature to find ways to support our hospitals, our long-term care facilities, and have open dialogue about what that would look like.
Yes, I'm happy to work with you as well. I think we share the same common goal. We want quality of life across the full continuum of care, but we also have to hold your department accountable for some of those policy changes, which, you know, just this past year, of the seniors that are going into hospitals, they're almost up to 2 days extended stay because beds aren't available. So we have this healthcare continuum, right? Hospital Association says 600,000 65 or older hospitalized last year. We can't get them out of the hospital, so they are in there where they get sicker, where they are more expensive, but we're refusing to fund the industry that could help everything out. Help me to understand, help me help you, I guess is what I'm trying to ask here. Help me help you. What needs to occur to better support our long care industry in this budget?
Yeah, Representative, thank you for your attention to this issue. It is certainly one that's a priority for our department. I think the line item that you're talking about is actually in the Medicaid budget, which is under DHS, and they determine kind of the reimbursement rate for facilities on the Medicaid side. So those
yes, totally agree.
Yeah.
But as a government, we have to work as a whole for our seniors. And your department, I'm imagining you're saying, I'm imagining you're sharing the information. 2,800 licensed bed offline just within one subset. Over 7,000 certified beds are offline because of this issue. So I'm imagining your department is signaling, right? I would, to quote somebody else, a 5-alarm fire, right? 9 hospital closings, multiple long-term care. We have $1 billion of new money going to schools, which we'll debate about, but we have not the support over here. There's just under 3 billion young people. There's just under 3 million young people. There's just under 3 million 67 and older, but we're not treating them equally. And are there ways that your department can bust through that silo and get them to recognize this very serious situation in Pennsylvania?
Can I respond? Thank you. So yeah, just to clarify, so there is a proposed increase of $10 million to the Department of Health for our long-term care transformation office, and that office focus is doing exactly what you're saying. So that office is really focused on quality care for residents. It's keeping people in their jobs, making sure that facilities can stay open, and we are looking at things like occupancy rates, hospital admissions, outpatient visits for residents, right? So those sort of activities are happening, and that's in that $10 million proposed by the governor. And I will say, just on the education piece, to be able to have folks who are able to work later in life in these facilities as our population ages, we have to put that money into education so that we know that they're qualified. So I'm happy to talk to you offline about this issue and how we address it. I think it's multifaceted, but I'd be happy to talk more about it.
Thank you, Mr. Chair. I appreciate it, because that's $10 million going for more government, not for more facilities. Thank you.
The money is is actually much of that money goes out to facilities, to be clear. So in that long-term care transformation office, it supports just one person in the office, but a lot of the money actually goes out. For instance, this year we funded 126 quality investment pilot projects with federal funds, and we're hoping to do the same with state funds to be able to implement this in long-term care facilities. And that money went out, again, to 126 long-term care facilities to do that hard work, infrastructure, workforce development, emergency preparedness, again. And for this $10 million we're asking for, most of it, almost all of it, is going out to facilities.
Thank you.